So I'm just doing a little bit of an interview here with Sean. So Sean came to our clinic following an incident that happened, which I'm going to talk about, and we're just going to cover really what treatments he had, what they involved, because sometimes when we're treating skin, it's not just one method that works, it can be a multitude. So what was it that happened that caused you to come to the clinic?
A grinder backfired and hit me in the face.
Wow.
And yeah, I was just getting complacent at work, so I've been doing it for about 2 weeks, just cutting these steels out, and then just...
It fought back, didn't it?
It fought back a bit, yeah.
And obviously we're using this interview as a follow-up, because I reckon, looking at the records, it must be about a year since it happened, and obviously we're acquainted, so we helped each other out.
Yeah.
And we looked at the possibility, so the initial, from what happened, and we'll probably show pictures as part of a case study. Initially, I was quite keen to get you some therapy. So you had sutures, you had stitches done by A&E, and they pretty much discharged you, didn't they?
Yeah.
There was no other ENT or dermatology follow-up. No. So I was quite keen to look at what treatments we could offer. What sort of things? Do you remember what we talked about? What we tried? We thought we'd try.
Was it taking my blood?
Yeah.
And then the laser treatment.
Yeah.
Yeah.
So we started simple, didn't we? We thought we'll leave those up there. So the first thing we did is we got you under the LED, so the light emitting diode machine, just to calm it down, because it was really red, wasn't it? Really small. It made it difficult for you to swallow and to use a straw and things like that, just to help with the healing. And like I said, they never called you back, did they? And your partner Rachel, she was having some skin issues, and she tried that, which we've talked about before.
Yeah.
After that, do you remember what we did?
The needling.
Yeah.
Yeah.
Do you remember what it involved?
Needling in my face around the skull.
So yeah, we used the needling pen. Now I know we sort of showed you how to do that at home. Was it you that did it, or was it
Rachel did it on my partner?
Yeah. So that's something that we've already talked about previously, as well. We're using a needling device, and it's not. It sort of got an up and down motion, and it causes breaks in the collagen. And what was happening with you is you were getting the new collagen, and we were trying to make that work a bit quicker.
Yeah.
Do you think it worked?
It definitely worked, yes.
It did?
Yeah.
And we'll probably take some pictures today, because it is, we thought we'd have to use PRP, which is another one of our treatments, and you weren't keen on having needles put into your lips.
No.
When did you last have the needling treatment?
It must have been about last July time, was it?
Was that long ago?
Yeah.
Wow. That's amazing. That's within 5 months to full healing. And normally with collagen, what we'll see when it's new, so if I've got a scar, usually it's pink for a good couple of years afterwards, and there's no sign of it. So, have you got full movement of the lips and everything again? Right, not drinking out of a straw anymore, unless it's by choice. So what did you think about it all?
I thought it was fantastic.
Good.
Yeah, really pleased with the results.
I would say would you come back again, but I don't want you to have an accident.
Well, it's in my job, so. Yeah.
And in terms of the downtime with the lip side of things, what was that like?
After a couple of months, it weren't too bad. So.
Good.
It was like a numbing pain for about a month, like you've been to the dentist, but that's all drifted away.
Good. And are you looking after the machinery a bit better now?
Yeah, definitely. Yeah, I get one of the young lads to do it.
Definitely. All right. Now, had you ever heard of any of these treatments before?
No, all new to me.
What would you have thought about these treatments? If you'd have heard about these treatments from an aesthetics perspective, so if your partner was saying, I'm going to have an LED treatment, I'm having needling, or I'm having peels, what would you have thought back then?
I would have definitely said no to any of that.
Why?
Well, I'm a man. There's a few scars now and again, not too bored, but obviously.
And do you think that's changed your mind?
Yes, definitely, yeah.
Good stuff.
Yeah.
Fantastic.
Okay.
Thank you.
Thank you as well.